My name's Leah Swain. I'm the Chief Exec at Sirius Minerals Foundation, a place-based funder over on the coast. I'm not going to be chatting about mental health and sport. I'll be handing over to colleagues on the panel, but I'll help facilitate the discussion. I guess from my point of view, we often think about sport and physical health, but I think over the last year, we've begun to really understand how sport impacts on our mental health. And from my own personal perspective, I know how important the chance I get a couple of times a week to go out with a few other mums, have a little bit of a run. Run's probably a bit ambitious, a very slow jog, but it's really about the conversation and being out in the open air that makes me feel better at the end of that exercise. I'll hand over to Marianne.
Good morning, everyone. Hi, I'm Marianne Jackson. I'm Head of Stronger Communities for North Yorkshire County Council. The programme that I run is public health funded, and we work alongside a range of voluntary and community organisations across the county on various programmes of social action. One of those in particular is around suicide prevention and improving mental well-being. And when we're encouraging applications for that particular programme, we ask people to think about something called the 5 Ways to Wellbeing, which was a public health framework around improving people's and maintaining your mental health. One of the 5 Ways to Wellbeing is around being active. And I think this particular framework recognises the role that sport and physical activity and maintaining your physical health has on being able to maintain and improve mental health. So because we run those programs, that's my particular interest in being here today.
Thanks, Marianne. If we move to Annette.
Hi, good morning, everybody. My name's Annette Greenwood, and I'm a funding officer with the Reaching Communities National Lottery Community Fund. My interest in mental health is quite varied and wide. Before I came to the fund in a former life, I spent 15 years on community projects that I'd set up and managed and run with the help of volunteers. Those projects had a wide range, and they started with isolated people, young mums, and I did quite a lot of work in the probation service in Northallerton, Harrogate and Skipton. And I also worked with male offenders from Northallerton Prison, and I did 2 years working in a women's prison in York. So the mental health interest that I've got is varied, and from personal experience as well, which I think is really important. So thank you.
Thanks, Annette. I'll move to David Watson.
Good morning, everybody. Yes, I'm David Watson. I'm the Chief Executive of North Yorkshire Sport. And we use sport and physical activity as a driver for positive change. So we're really interested in the role that has on people's physical health and well-being and mental health and well-being, but also their opportunities to engage in other things. So whether that's employment or education or training. And we're not particularly a funder, but we work with a number of partners, and we do run a number of programs. We're involved with the Thriving at Work program, which is supporting people people who may be neurodiverse to help them into further employment. We've a big program at the moment called Exercise at Home, which is funded through the lottery, which is about supporting people aged 65 plus around deconditioning and being more physically able to get out and about, but also really big focus on their confidence and aspiration to, as the world's reopened up after COVID, people are maybe physically able to get out and about, but might not feel confident. So a lot of what we do is around that confidence and aspiration, not just amongst older people, but right across the population. So that's us.
That's great. Thank you, David. And I'll move to Lisa.
Morning, everybody. I'm Lisa Wilson. I'm the Service Manager for Communities at Hambleton District Council. My sort of interest in mental wellbeing and sport is wide and varied. We do lots of delivery. So in terms of supporting people that are isolated. We have a number of programs through our inclusive sport program, and that's about getting people up and out and active, but notwithstanding the social aspect being as is important for people's well-being. So we do, you know, sort of run activities out in our villages and in our market towns to try and encourage people that, you know, can be socially isolated because of where they live to sort of come out and meet others and sort of join in the activities. So we've got a range of activities that we do, sort of bocce, disability football, new age curling is another area that we do. And as I say, some of those are in the market towns and some are in the villages. We're also the sort of lead organisation, I was saying, developing facilities for sport and physical activity. So I'm involved in a number of programs and projects to improve facilities, whether that's community facilities or council run facilities. And we're currently trying to develop 2 sports villages, one in Sowerby and one in Northallerton. We also work with a wide range of sports clubs and voluntary organisations, and I've got a team of development officers that can support clubs that are looking to either develop activities or develop their facilities, and we can help with funding searches and advice and information on that. Thank you.
Lovely, thanks Lisa. I'll go to Mary.
Hi, I'm Mary Musingi and I'm a grants manager at the Henry Smith Charity, and I also manage the Strengthening Communities program. I'll give a presentation later on the program. At Henry Smith, we have 2 main programs, Strengthening Communities and Improving Lives. And mental health cuts across the board when you look at the various themes and priority areas that we fund as an organization. And under Strengthening Communities, we look at supporting organizations that enable people who are excluded, vulnerable, or facing other forms of hardship to have access to community-based services that support lasting change. And the organizations we fund provide a range of services, and quite a number of them include sports and physical activity in the services they provide, mainly to improve mental health and well-being, reduce social isolation, enable increased confidence, enable access to volunteering opportunities. So really mental health and good mental health is at the heart of the organization. And all the programs we have look into issues to do with mental health and how we can support the organizations that are delivering services or activities around mental health. Mm-hmm. Thank you.
Thanks, Mary. And our final panelist today is Mark.
Good morning, everyone. Yeah, my name's Mark. I work for Community First Yorkshire as like a health partnership development manager, but with a big emphasis at the moment on mental health and well-being, because within the 10-year NHS plan, within the big NHS plan, there is a 10-year ambition to transform community mental health services. And that's not just about the public sector provision, it's about recognising and valuing the contribution of everybody on this call today, participants and speakers, and the difference that we make to people's lives. What I would just say is that the new approach that has just been launched in North Yorkshire is quite embryonic and places a greater emphasis on the role of voluntary sector colleagues, but also on people with lived experience and on this idea of co-producing solutions together. But what's really fascinating about it is that whilst it's about mental health and well-being, the other aspect that's been prioritised is the physical health of people with serious mental illness. So I think the best is yet to be, and I think we just need to continue to remind ourselves, in line with the mental health theme, that as a sector we are awesome. Thanks very much.
Thanks, Mark. A good note to finish on.
It is, yes. Right, thank you very much, panelists. We've obviously got a wide and varying range of skills and experience here. So do post your questions in the chat and I will field those questions. We're just going to start with one pre-submitted question from Professor Peter Brophy. And he says, I wonder if the experts on the panel could address the question of what they see as the key contributions of community groups to mental well-being, as specifically as possible, and how this has changed because of the experience of COVID. Okay, over to you. Do you want me to repeat it for your?
No, that's great, Hilary. Would one of the panel members like to pop your hand up if you want to pick up the question, and I'll take it from there. Marianne and then Mark.
I think there's a really strong track record anyway across North Yorkshire of the voluntary sector contributing to people's mental well-being. We've got, you know, thousands of charities across North Yorkshire who support people week in, week out, particularly around things like loneliness and social isolation, whether that's by running social activities or alongside some services. That track record has always been there. We've increasingly seen great collaboration as well across the county with different charities, understanding that people don't want to be passed from pillar to post. And there's a great example in Harrogate that's developing called Route 1 to Wellness, where a number of mental health charities are working collaboratively. So whoever picks somebody up, whichever charity is gets the first contact with somebody, they will support that person around the various services that their 4 charities are able to offer. But further than that, they'll also link out into the community and support people to participate in various activities or social events that other smaller local charities are offering as well. And I think this has ever been the case, and I think it's something North Yorkshire is really blessed with. What we've seen through COVID is that in kind of turbo boosted, the massive response from volunteers and voluntary organisations to support the whole community through the pandemic has been humbling and phenomenal. From the County Council, we recognised that from the outset when we knew we'd have to support people through the pandemic, and engaged with over 20 voluntary organisations across the county that became known as our community support organisations. As we've moved through the pandemic, at the beginning, you know, everybody was locked down, everybody was in the same boat. But as we've moved through the pandemic, for a lot of us, the restrictions being lifted meant that we could continue to carry on with our everyday lives. We could do our own shopping, we could start going out to restaurants and other events again. But for some people, and I think particularly older people, and those who were classified as clinically vulnerable to the pandemic, the lifting of restrictions hasn't brought the same benefit to them as quickly for some of those as it has for the general population. And I think what we found is that people's confidence has taken a knock, particularly going out shopping, going to the supermarket suddenly, where they're not being used to being in crowded places. What they're finding is that, you know, there's lots of people there and actually they don't feel ready to make that leap yet. What we're seeing voluntary organisations and charities do, the role that they're stepping into now is supporting that confidence. We've seen people's physical health deteriorate through the pandemic. Their people who are at risk of falls, for example, have lost their physical conditions deteriorated. And what we're seeing, voluntary organisations and charities stepping into the space to actually provide safe and supported ways to allow people to start to regain and retain their independence. I won't go into specifically the stuff around physical activity, because I suspect David Watson from North Yorkshire Sport is far better placed for me to do that. But certainly with our community support organisations, the types of things that they've been organising are gentle walks, socially distanced walks where people are made to feel safe, where they know that people will still wear face coverings, will still follow the COVID guidance in order that people can slowly start to rebuild their confidence. So always had a great track record. And I think what COVID has shown us is just how valued and valuable our voluntary sector is across the county in supporting people, particularly people who may have an additional vulnerability.
Thanks, Marianne. Mark, I think you wanted to come in.
Yeah, I was just going to add to what Marianne said. We work alongside a social enterprise within North Yorkshire called the Health Creation Alliance, and their research, their engagement with people both within North Yorkshire and nationally shows that people need three things, or any of us need three things in order to be healthy and to remain healthy. That's connection, control, and confidence. And those are the things that when the pandemic first hit, were the greatest risk beyond the actual virus itself. And the great thing about the voluntary sector, alongside neighbours, friends and families, was that we all found a way of coming together, working together safely to make a difference for those people who were in lone households, to make a connection. I think it's going to be really interesting to see how we build on what we learned during sort of the whole pandemic sort of episode, because one of the great things about it in terms of the role of the voluntary sector, voluntary and community sector, was that nobody waited for permission to do things. They got on and they did things. And what the public sector and other funders did was they found ways of responding in a very sort of flexible way, in quite a light touch way, which really enabled things to happen. Hope that helps. Thanks.
Thanks, Mark. I mean, those three words, connection, control, and confidence, they almost feel like a funding round for me. So I'll be taking those away. I can see a few other people nodding. Lisa's here from Health Creation, and she has popped a link in the chat box if anyone would like to pick that up. I could see you smiling there, Lisa, a little thumbs up for Mark. Mary, you've got your hand up to respond. If I take your comments, and then I'll just come back to Peter in the audience to check we've answered the question. All right, Mary.
Just very, very briefly, we found that community-based organizations have that connectedness in the community, and they're very embedded within their communities, are well informed about the needs and issues and the challenges experienced by their communities. And in most cases, they're well placed to deliver services that improve mental health and well-being. And when we carried out a survey of our grant holders last year on how they responded to the pandemic, quite a number of them told us they were firefighting for social services. And at times they were the immediate responders to issues in the community. Some of them thought some of them said this is a long-term trend, and were picking up the pieces left by local authority because most staff were working from home. And for some of them, they may not even have the skills to address some of the issues they're dealing with when it comes to mental health, but they had no choice. They looked at new ways of working, for example, online activities, putting people who are shielding in contact with each other, doing doorstep checks. And I think for quite a number of people in the community, they realized that there's a place they can go to. There are people out there that can support them. And I think it's around what packages and what support can be given to community-based organizations or organizations providing support around mental health and mental well-being, whether it's training, whether it's funding, to enable them to do their work effectively. Yeah.
Thanks, Mary. That's really helpful. Peter, did you want to come back at all?
Yeah, thank you very much for that. It's very helpful and some interesting thoughts there. I think the one area that nobody's touched on, perhaps, that I'm interested in is that technology has in many ways helped us through the pandemic, has helped people make connections and has actually created new connections, which are very interesting. For example, we're no longer as place-based as we were. But what it hasn't done, of course, is, or what it's exacerbated, is exclusion of those who don't have access to the technology. I just wondered if the panelists had any thoughts about how, as a community, we might better address that particular problem, because I see it as being a real divide in our society now.
You sneaked another question in there, Peter. Peter, I'm going to hold that question just for a minute because there's a couple more coming in the chat bar and I want to give everyone a chance to ask one. But if we've got time at the end, I'll come back to digital divide with you. Hilary, I'm just going to pick up the question in the chat bar from Abigail because it picks up on something that Mary said there. Mary was talking about community organisations being well placed to support physical and mental health activities in the community. Abigail's question is that Community Works in Thirsk is very much doing that. It's an asset-based, place-based organisation, but they're struggling to secure funding for support groups to reduce mental ill health, including for sports. Their feedback from funders is including things saying they're not a mental health specialist charity or that they don't demonstrate value for money as changes don't happen overnight. I think as funders, I think we can all empathise with this question because it's one of the most difficult ones to differentiate applications that come into the foundation. I'm sure others around the table feel the same. Would any of the funders like to pick that up? Mark, I'll come to you first and then perhaps Annette or Mary. Thanks, Mark.
Yeah, I mentioned earlier about the new initiative that's starting up in North Yorkshire, which is about transforming community mental health. There is an assumption that you don't have to be a mental health organisation to engage in it. And at the moment, there's the embryonic Hambleton and Richmondshire mental health partnership that's coming together. And I think Community Works are involved in that. But it's this idea of co-production, of coming together, people with lived experience, the public sector and the voluntary sector, to look at sort of tackling some of the challenges. And that might be funding challenges, and how do we get our message across to funders in order that we're better understood, in order that we can make a difference. Outside of the meeting, I noticed there was a further point about measuring the impact in relation to mental health. I'd be happy to.
Oh, you flicked yourself on mute there, Mark.
No, somebody else muted me. No, I'd be happy.
As a member of your team.
Yeah, no. I'd be happy to have a conversation about that outside of this conversation. I just appreciate there's the physical health dimension as well, which can make such a difference to all of our mental health and well-being as well. Cheers.
That's great. Thanks, Mark. Annette?
I think as a funder, over the last, 18 months that we've had the pandemic, without exception, every project that I've worked on or helped to secure funding has had an element of mental health, ranging from social isolation to, the more serious sort of named mental health conditions. And every one of them is looked at as an individual, and everything is taken into consideration. And it's it's difficult sometimes to not want to fund everything that's there. And because of the situation now, I say this hand on heart, I have not seen an application that hasn't got some mental health in it over the last 18 months. And I can only see that, you know, progressively getting worse over the next 18 months, that everything with it. I mean, it is one of our, one of the fundamental things that we want to fund, mental health. And I don't think it matters at what level or what degree it is. We are open to all applications that that have a mental health priority with it, really. That's the best I can say, because that's the honest answer. Everything has got a mental health thing in it now. It really has, Leah, really.
No, it is a genuine challenge for funders, I think, because like you, virtually every application mentions it. Lisa or Mary, you've both got a lot of experience in these areas of applications. Lisa, how do you look at differentiating or helping groups to differentiate themselves?
I think we're not a massive funder in terms of grants that we give out to the voluntary and community sections, and our difficulty is the main one that we have, the Making a Difference panels, are run by our elected members, and although there's a sort of grants criteria, the way that they sort of determine which projects they want to fund is down to them, really. So what I would say in terms of looking around our grant scheme, it's always difficult, and I know sort of Abigail's charity really well, that tend to be looking for funding for posts, and that's just something that our district councillors are not particularly see as a priority, because it's the way the programme runs. It's a 1 year grant scheme, and that they're worried about sustainability and that type of thing. So I guess from our point of view, if there's elements of projects where we're not looking at funding a full-time member of staff, if you could sort of break the project down into sort of smaller elements that could be a little bit more discreet. I don't know, if there's pieces of equipment or sort of room hire, those sorts of things tend to sort of sit better with our elected members. But it's tricky.
Thanks, Lisa. Did any of the other panelists want to come in before I just pick up the impact question that's come in? Mary, and then David.
I do agree that you don't have to be a mental health specialist charity to provide mental health services. And I feel that community organizations are well placed to identify or to kind of be the immediate responders to situations. And if they're connected with members of their community, they can provide services that enable the prevention of mental ill health and also improve mental health and well-being. And if I give an example of maybe a young person suffering from onset of psychosis, it's that community organization they go to that can be able to look at the triggers on that and maybe signpost them to hospital care or to a mental health specialist service. But when they're discharged from hospital, when they come back home, it's that community they're coming back to. It's that community organization that is going to offer them opportunities for volunteering or skills building or reducing isolation. So I think we in Henry Smith, we find lots of organizations that provide services to improve mental health, and not all of them are mental specialist charities. And their number in the community that are doing excellent work with their community members in reducing some of the challenges people are facing.
I think that's right. Thank you. David, did you want to come on to that one, and then I'll move to the next question?
Yeah, I think there's two sides of it for me from a sport point of view, and I think one is for funders to better understand the role of sport and physical activity in this case in mental health, and Mary, talked about the support that people get as they come back into the community, or so it's not necessarily about treatment it's a kind of about how people live with things. So I do think there's a bit of a need for funders to perhaps not always get blinded by the word sport and physical activity and think, well, this is a sport project and it's about making athletes. But, you know, alongside that, the sport and physical activity has got to get better at explaining that, and has got to get better at focusing on the outcomes of what they're trying to achieve and the outcomes of what the funder is trying to achieve, and less focused on the activity. You know, so you know, Abigail talked about you know, they do walks, and so actually, you know, it's not the walking that's the important bit. Nobody's going to fund you to take people walking necessarily. It's about what is the outcome of that. So I think there's a two-sided bit to that, of both the sector supporting funders to better understand, and funders being kind of open to that understanding. So yeah, it's just a quick point really.
Thanks, David. So there's a few pointers there for Abigail. One is that funders are really looking for the voice of the potential beneficiaries to come through to understand how they've shaped the services and how they've helped co-produce it. I think it's really important that applicants also are really clear in their application how they'll refer to statutory services or to specialist mental health providers if an individual's issues become more acute. And if we don't see that in an application at Sirius, we tend not to fund it, because that concerns us whether the referrals will be made. And then there's a point there around you need to be able to show an outcome and be able to measure the improvements in the well-being and the resilience of individuals, which I think comes nicely onto a question from Tanya, who's asked, when a grant application asks how will you measure and report on positive changes made, can we give some examples of how best to answer that with regards to mental health? As a charity, they ask for feedback from clients and do PHQ-9s for discussion, but wonder how we can report. Tanya, do you just want to explain PHQ-9s? And then we'll see which panelist wants to pick that one up.
Yeah, of course. So kind of GPs and kind of mental health professionals will use kind of PHQ-9s, which are 9-10 questions to look at how an individual is feeling over the last couple of weeks, in a way to diagnose and also to monitor depression. So we're not a kind of, well, most of us aren't trained as a kind of mental health professional. We offer support. So we kind of do them to initiate discussion, but also to highlight. Like, that's actually what you really helpful about referring to statutory services. So if someone did say they were suicidal, we would now then have to follow our policies to refer on. So I guess it's more just, yeah, kind of how you answer the question, how we can use all the data we've got in the best way to show the funders kind of, yeah, the positive impact that we're having on people.
Lovely, thank you. Annette, and then Marianne.
I guess the simple answer to that one, Leah, is around the word that keeps mentioned about impact. So we don't sort of try to control anything that applicants might be sending in to us, but we ask for a bit of a broad spectrum. But the most important thing is think about what your project does for Mrs. Smith, who lives at 47 Raspberry Road. What does it do for her? And she came onto your project, maybe socially isolated and not going out, and you know, really withdrawn. 6 to 12 months into your project, she's going out, she's engaging with other people. She might be going on, you know, workshops or shopping with somebody, or engaging in a little bit of sport, or she's got a befriending person coming to see her. It's all about what has that particular project done for that person from when you took them to when you're now doing your report. And that sounds quite simple, and I know it's difficult when you've got numbers and you're number crunching and everybody wants to know what percentage this, that and the other. I think we're more interested in really what the impact's doing, and yes, how many people you might be serving on your project. You know, if you come to us for funding, you say you're going to serve 1,000 people and actually it's 500, that doesn't matter. It's about the quality rather than the quantity, I think, is the best way I could answer that.
Lovely. Was there any other? Oh, Marianne, sorry.
Yeah, I think it depends on the project as to the type of monitoring and evaluation that a funder, well, certainly from County Council as a funder, that we would expect organisations to undertake. If we mainly fund preventative projects, and so we wouldn't necessarily expect that one-to-one tracking of people's mental well-being. Sometimes we do, and there are various tools that are out there that people use, and Tanya, I think you mentioned that in your question. My understanding from TUVE, the local mental health provider, is that the preference is moving away from things like the Warwick-Edinburgh scale, which I know a lot of voluntary organisations have struggled to use in the past. And there's something called REQOL now, REQOL, which I think the University of Sheffield has developed. Yeah, and it's a bit friendlier, I think, for that one-to-one tracking. That's all I know about it. I'm not an expert on it. But certainly for the types of projects that we've been funding through our suicide prevention and mental wellbeing grants, we wouldn't look for that level of data necessarily. We're very much more alongside the personal stories. Yes, we need some numbers. We will need some numbers, but where people who've been involved in the project are given their voice to talk about the difference that it's made to their lives, what they're able to do now at the end of the project compared to where they were at the beginning of the project. That real qualitative information is the types of things that we tend to report back on. The funding that we have for that particular programme comes directly down from the NHS. And that is the type of information that they're really, really interested in receiving. So when we do our annual monitoring reports for them, that's precisely the sort of thing. So it's just taking that time to have those conversations at the beginning with people and then checking in with them and really giving life to their voice at the end of the project.
Thanks, Marianne. That's really helpful. So a few tips coming through there. I'm certainly going to have a look at that REQOL tool from the University of Sheffield. And there's the offer there from Mark Hopley and the team at Community First Yorkshire if anyone would like to do more work around developing their measurements of impact. I'd also say that some funders often have a learning partner on mental health grant rounds. Certainly the grant round on mental health we're about to launch has its own learning partner. I would really suggest people take advantage of seeing how those learning partners work to help with the measuring of impact. Okay, we had some other questions in advance, didn't we, Hilary? I don't want to forget those ones. Do you want to feed another one in and then I'll come back to the chat box and Carol? Yep,
sure. One is, many funders talk about raising the aspirations for young people and improving mental health. What are your thoughts on potential sport outcomes for that?
Who wants to pick that one up? David, you come on.
Probably should, I suppose. What do I think are the sport outcomes? I think I might not be answering the question, but I think the role of sport and physical activity around raising aspirations for young people is significant. We certainly have a number of things that we're involved with where we use the principles of sport and physical activity absolutely as that. So it's not about making somebody a better footballer or whatever, you know, the particular sport is, but about using things like the principles of teamwork, about how you deal with setbacks. We do a lot of work with ex-professional athletes who will, you know, use their story, use their experience to support young people, you know, with how they deal with setbacks. And actually part of the challenge for young people in terms of their resilience is actually experiencing success, because if you don't experience success, then it's very difficult to deal with setback and deal with perceived failure. So sport and physical activity has a strong role in providing that success, and that isn't about winning football matches. It's about, you know, kind of some broader things. So I think if that may not be answering the question, but I think for me, it has a huge role in that aspiration and confidence and resilience, and not just amongst young people, amongst right across the population.
That's lovely. Thanks, David. Lisa.
Yeah, I was going to concur with what David's saying there. It's not necessarily the sport outcomes that potentially looking for, it's the other things that vehicle helps that individual, and obviously particularly for young people and coming out of COVID, you know, they've been affected significantly with the way that they've been able to sort of join in sport. You know, a lot of the sport activities were on hold for a long time, and we're sort of supporting clubs to get back up and running and sort of focus on the young people, but using sport as a vehicle for other things that would support their own sort of mental well-being. So I guess for us, it's not the sport outcomes that we're necessarily looking for, it's the added benefits of participating and all the other stuff that you learn that David's mentioned there.
That's really helpful. Thank you, Lisa. Carol, you've popped a question in the chat. Do you want to ask your question? There we go.
Yeah, my question was in the chat, and it was really sort of around the fact that
I think we're struggling to hear you there, a few shaking heads. Can you shout at us?
Right, I'll try again. Can you hear me now?
Perfect.
Is that better? Okay. Yeah, my question was around one of the points which was mentioned earlier, which is about the biggest thing of getting people active is actually that they need the confidence to actually decide to participate in something, and that doesn't matter what age that is. That's young people as well as older people, and people that have perhaps walked away from sport and perhaps want to get back into sport. One of the things I think which the sector struggles with from a sport and physical activity point of view is what I'm talking about, whether that's public sector bodies or whether it's the voluntary sports clubs, is actually if we start talking about mental health and people coming along to sessions and activities, that's a bit of a scary thing for the coaches and the staff. So what I'm interested in is about funders' approach and views on actually funding training and appropriate training for paid workforce and for volunteers, and also about funding campaigns which would encourage people to be active. But what we need in campaigns is not direct messages about mental health. It needs to be very subtle, clever campaigns which directs people towards activity to achieve the outcomes that people are talking about. So I'm just interested from a funder's point of view, their views on funding those types of activities.
That's great. So Carol, when you were talking about funding training, is that, for example, for sports club coaches to be able to think wider than just physical activity, but impact on mental health as well? Because that is quite an intimidating ask, isn't it?
Yeah, exactly that. I think, you know, sports club coaches will be trained technically in whatever their sport is, but it's about, you know, training people who can be to operate buddy systems in sports clubs or in leisure centres. It's about having community champions within clubs and within sports facilities, but there needs to be some training and support for those people to be able to engage appropriately, and so they know what to do if the signs are beyond low-level mental health issues.
Lovely, that's great. So David's got his hand up, and then I might come to Marianne around that, the benefits of the campaigning work. What runs through my head as a funder is that a public health obligation or a funder's obligation or a community obligation? So David, you first.
Yeah, I'm going to cheat a little bit if I can, and not necessarily talk from a funder's point of view, but I agree entirely with what Carol's saying, and I think there's an issue around the broader workforce, around the benefits of physical activity. So I think beyond people who are actually delivering sport and physical activity, I think about care workers, you know, whoever it is who is coming into contact with people who may have either physical or in this case mental health worries, about them better understanding the benefits of physical activity and then better being able to advocate for it. So that isn't necessarily, that could be about advocating that they go to the local leisure centre, but it also might be about advocating that they just do some physical activity in their own home, or they, you know, a care worker goes in and they encourage the person to get up and go and make a cup of tea with them rather than bringing the cup of tea. So I think there's definitely something there. We are, so we're very keen on that broader workforce. In terms of kind of training specifically for clubs, we've certainly done some work in the past and part funded at different times by public health around mental health first aid. So we can train coaches within clubs or facilities around mental health first aid. We're also working with all of the leisure operators across North Yorkshire on the introduction of an app which is called Welcome Me, and that allows somebody with a disability, but it equally could be with mental health concerns, to let the facility know in advance that they're on their way, and that enables the reception or the staff to make any preparations that they might need. So that could, you know, that could be somebody in a wheelchair, and making sure that their money can be taken off them when they come through the door. So things like that, and what will run alongside that is that the leisure operators are committed to training of their staff around some of those things. So yeah, I think the workforce is a key one. Again, if I can, we've done some work with local authorities around swimming pools, particularly around being dementia friendly. So again, changes that can be made to the signage and the way that facilities operate. So there is stuff out there, but I think it should absolutely be a priority.
Thanks, David. Marianne, and then perhaps any of the other funders on the campaigning or training.
Yeah, the county council obviously hosts the public health function, and in addition to the formal mental health services that are commissioned through health and social care, public health also fund various public mental health services and activities. One of which is training and access to training, and we have it was launched pre-COVID, but then, you know, that 18 months where everything seems to be squashed into 1 week, launched a mental health training hub, and that hub is designed to put all the training resources in one place, including access to any voluntary organisation who wishes to train their workforce and their volunteers on mental health first aid, mental health awareness. We've also got suicide assist training, so suicide prevention and awareness training available as well. What we're really keen is to expand our number of providers who can deliver that training. There is massive demand, and trainers come and go. We train somebody within an organisation and then they might move on somewhere else and we've lost a trainer. So one of the things that we'll be really focusing on now, we're able to start doing face-to-face training again, because through the pandemic we've not been able to do that, is we'd love to hear from organisations who would be keen to undertake what we call train the trainer courses. And that means that we've got more organisations who have got people who are trained to deliver things like mental health awareness and mental health first aid. The more people who've undertaken that training, whether they're volunteers, whether they're just members of the public, whether it's companies who train their workforce in that, means that you have those advocates in communities, you have those people in communities who, wherever they work, whether it's in the hairdressing salon, whether it's in the cafe, who are able to spot those signs and to start signposting people through the relevant services as or within the voluntary sector, depending on where people are. In addition to that, there are a number of national awareness campaigns that people will, the Suicide Prevention Day and Mental Health Day and so on. And the public health team certainly get behind that and publicise some of the good work and services and activities that are available across the county, focused on those days. But that's just one day. Another thing that public health have been have promoted in the past is things around behavioural insights and social norms campaigns. And social norms is where you look at what is okay rather than trying to tell people what not to do. You highlight the good practice that happens in communities. They ran a social norms campaign, particularly around men's mental health, about being okay to talk. I think that's one area where it's seen that there are fewer opportunities for men to get together and talk about their mental health. And so public health put their resources behind a campaign that tried to unlock some of that and put out messages around, particularly targeted at men, and it was designed with men for men, to really promote that it is okay to talk about mental health and to really normalize that within the community. So that's just a bit of a snapshot of things that we're doing. I'll post the link to the Head First website in the chat. So if people want to access that and have a look at what's there, as I said, a lot of it's been virtual over the pandemic, but we're starting to be able to move into face-to-face training again.
That's lovely. Thanks, Marianne. And thanks for your offer of the Train the Trainer support. And also, David, you picked up the mental health first aid support there. So we can always share those if anyone needs to come back on those. Annette, I'll give you the floor.
If I'm understanding the question correctly, in terms of training, as a funder, when an application comes in, that's a part of the conversational approach is around what the project needs, what it wants, whether that be staff training, whether that be anything else related to those kind of costs, really. So that's one of the things we are very open to, and that's not a problem as far as I'm aware. In terms of campaigning, my honest answer is I don't know, but I could find out. So I'd rather not say that I know for definite, because I haven't ever seen a project. I've never worked on a project. I had an application that has requested funding for campaigning or anything to do with that. So I'd rather not comment, if I'm honest.
Lovely, thank you. That's interesting. You've never had one with campaigning, and I've yet to see one come in either. So perhaps there's a challenge back there to providers to say, why not try putting one in and see what the funders do with it? If it's anything like me, I'll be sending it up to the trustees for review. I just want to thank Lisa Holden, who's putting lots in the chat bar. So thanks, Lisa. There's some really interesting stuff there, and I'm sure the team will send round those links after the conference. We've got literally 2 minutes left. I'm going to give the panelists a couple of sentences each to address Peter's question on the digital divide. We've done some great inclusion work using digital, but have we now excluded anyone in the kind of sports mental health arena? And then I'll close the session with Hilary's help. David, do you want to pick that one up?
Yeah, I think digital is one tool. It's not the be all and end all. We've got people who pre-pandemic were not accessing things, who will still not be accessing things now. We've got to get a balance of providing the right things in the right place for the right people, which I know sounds dead easy to do, but it's a tool, but it isn't the only tool. But as a sector, we've got to get better at using digital. Not sure that answers Peter's question, but it's as best I can do.
You've given it a great shot. Thank you, David. So we're coming up to the end of the session, which finishes at 12:10. I'm looking at Hilary, squinting at my screen to see her nodding. I just want to give a big thank you to everyone who's come along to the session and giving your time to listen, and also to our panelists for giving their time and sharing their experience and knowledge.